My name is Amy Mansue, and I have the privilege of being the president and CEO of Inspira Health System. Inspira Health System acquired Salem Medical Center in December of 2022. Today, we are here to be able to present the annual public meeting. We thank you very much for joining us. For those of you who are online, you'll see a process to be able to ask questions at the end. The objective is that New Jersey law requires that every hospital conduct an annual public meeting organized to provide the community served by the hospital with information about the operations of the hospital and provide the opportunity for the public to ask questions and raise any issues of concern. The relevant points of today's presentation really stem from our acquisition and the focus that we've had. I will go over many items that apply to the Inspira Health System as a whole and try and be specific as we can in reference to Salem. Our focus right now has been on providing access, making sure we share with you our goals, the investments, the quality awards, and then to review the financials. Obviously, the most relevant point for us is the day of the acquisition. We are tremendously proud of this work, and I want to thank all of our elected officials and all of the people who were so critically important in making this happen. This certainly could not have happened without the support, the generous support of the state of New Jersey, the Joint Budget Oversight Committee, and all of the legislators. Why was this so important? It's important because we have to ensure access for Salem County residents, and this institution has been a critical part of that history, and we need to make sure that we continue both to provide those services, provide that access, and also relook from an entire community perspective across the entire county about what the programs are and the services are that need to be continued. We are committed to expanding that access and really looking at our community health needs assessment from the Inspira perspective. We believe that the commonality that exists among many of the challenges that are faced really come from some of the systemic issues that must be addressed. We must make sure that we continue to look at how people are using services, and most importantly, ensure that those services that they need, based upon what the needs assessment shows and what our health outcomes are, really meet those needs. So as we look at the Inspira Health needs assessment for 2022 to 2024, these were the areas that showed up overall in Gloucester, Salem, and Cumberland County, and they were not that much different county to county. In some cases, they were ranked in different order, but they all had commonalities. Obviously, this was done when COVID was still in its height, and so COVID-19 showed up as one of the key areas. The issues in reference to mental and behavioral health and really ensuring that we had access to services, that has been a problem for many, many years, but obviously the height of COVID only brought it to the surface more and more. As we look at the accessibility, availability, and affordability of care, that continues to be a challenge for people. We see that the cost of health care continues to prevent people from accessing services and often are reliant on the emergency rooms to provide those basic services of primary care because the services that are available are not available in the hours after people get off work or in a way that is convenient for them. And we understand also that the access to children's health care showed up across the board in all three counties. Not just pediatric care, but really specialty care, and that only gets exacerbated when you really look at that need for psychiatric services for our children. And then again, we know that we often face tremendous challenges in reference to access to food and making sure that they have the right nutrition. We find ourselves in a situation where we still have health outcomes that show that we have a very high rate of obesity, knowing that that really stems from not having access, which seems so odd to be able to say and when we're in this place of the Garden State, especially down here, but not having easy access to fruit and vegetables. And so again, that continues to be an area of foremost. Often the hospital ends up in a situation where we receive these issues because they exacerbate health concerns. So we will not solve all these issues, but we will come together with the community to identify how best these resources can be developed and can be expanded. As we look at the 2023 goals since Inspira has taken over, our goal has been around workforce stabilization, leadership recruitment, building repairs, replacement, and quality, and vendor debt and credit stabilization. These are the areas that were most critical for us to ensure that we can provide the basics to our community, making sure that access remains open and really addressing some of those fundamental needs that existed. So let me show you what we've done. As we look at the investments and upgrades we've made, and these could not have been done without the tremendous support of the Inspira Board of Directors and the state of New Jersey. $30 million in state funds used to purchase the real estate, facility upgrades, equipment, and also address the vendors that need to be paid. $15 million line of credit was to pay those vendors. We had $3.4 million that has happened in the last 7 months where we've invested to make these repairs that you've seen, whether it be the parking lot, the HVAC upgrades, the nurse call system, the equipment and generator, some of the basics, the walk-in freezer, the fridge, the dishwasher, all of those things needed to be addressed. And of course, another $3.5 million for IT upgrades. We know that hospital security is critical from an IT perspective, and making sure that those upgrades were in place have already been accomplished, and we will continue to move forward on that through the rest of 2023 as we continue to ensure that safety. One of the things that we're most proud of is our investment in staff. We've been able to recruit very, very talented staff to be able to fill many, many management positions that were open. So we've hired 25 staff positions. We've fulfilled 7 or 8 of the management positions that are open. We've moved several Inspira leaders to Salem, and we are actively recruiting additional leaders. So people have taken stretch assignments, have come on and provided that expertise here as well. We also are going to work to be able to bring in some of those services that we provide at Inspira, whether it be coders or financial counselors or our patient registration folks, which we're currently outsourced. And we've invested 3% an increase for our employees overall, as well as a significant increase for the nursing that the nursing union was able to negotiate. Our community impact. These numbers that I'm going to talk about next refer to the community impact of Inspira Health. And you can see that we've made a consistent community impact over the coming years. And we do this through a variety of functions. These are specific to Salem County. There's a 9.9 million, 9.7 million, 9.2, and 3.6 so far as we've proceeded. Those dollars will continue, and we will continue to support our organizations, really looking to make sure that we identify those needs and partner as we move forward. As we look forward, we have requested the Department of Health and the state of New Jersey to allow us to fully integrate Salem into Inspira Health. This will allow us to gain the synergies that are necessary for a full integration. We are working diligently to stabilize the finances of SMC and ensure that we are able to proceed with a different outcome than the last 3 owners before us. Here are some statistics that exist. You can see the admissions numbers, 1,759, over 16,000 emergency room visits. We have 113 licensed beds, 189 medical staff members, and 415 employees. So part of our presentation today discusses the operating margin for 2022, and one of the critical elements to point out here is obviously Salem was in a situation of distress, which is why we ended up coming in and purchasing them. So before all of the investments were made, there was a $24 million operating loss. And you can see that the operating expenses were 61, the revenue was 37. There was a $59 million investment, both from the state of New Jersey as well as the forgiveness of a loan that was done by the Salem Health and Wellness Foundation. And that's how you end up with a bottom line that shows that. But it would be remiss if I did not honestly describe that there also was $35 million that Inspira had to pay off as part of the paying off of the vendors to be able to stabilize part of the work that we're doing here. So while this is how the books look, and that's what you'll see if you go to the audited financials, I want to be clear about just how desperate the situation was and why Inspira's board of directors felt so strongly about stepping in. So I've given you a quick overview. I do not see any community members in the audience, but I'm glad to answer questions if there are any on the screen.
Not yet.
Okay. Well, at this point,
So we can field some questions from the audience if there are any, while the attendees on Zoom kind of catch up. If there's any questions from the attendees on Zoom, please type them into the chat. In the meantime, if there's any questions from the audience, we will take them and I will repeat them for the participants online.
so one of the questions I would expect to be asked is, how will we address some of the needs that exist in Salem County? We know that there is a higher teenage pregnancy rate in Salem County than there is in the rest of the state. We know that there continue to be challenges in reference to the spread of sexually transmitted diseases. And what I would say is that we are actively working with all of the community organizations to address these issues and think about what is the plan to be able to move forward. We know that there are tremendous challenges in reference to recruitment of staff. We've been able to successfully recruit and fill those positions, but we also know that this exists within our communities. And so looking for those partnerships, we are working with the Federally Qualified Health Center. We're identifying opportunities with the County Health Department, again, to ensure access for our community and ensuring that we all do this work together. Many of the problems that exist do not stem from one area. It's really systemic poverty that exists, and we must be able to solve those situations in really looking at how we address those basic elements of providing jobs, providing access to care, and then being able to move forward. We're very encouraged by the work that we've seen on the Windport and the jobs that will come from that, and we're very grateful for the county with their partnerships that they've offered to us and that we will continue to work on together.
Still no questions online.
Okay. There don't seem to be any questions in the audience either. Megan, I believe that the opportunity for individuals to continue to ask questions that through the Zoom will be available, and so they can ask them after, and we'll certainly get back to them after. This presentation will be on our website, and people will be able to look at that, and there also is the opportunity on our website to send a question in through our information, general information, and again, it'll get to the right people and we can make sure that those are answered.
That is correct.
Okay. All right, well, on behalf of the Board of Directors, I want to thank all of you for being here today. I want to thank the State of New Jersey for providing us the opportunity to be able to share this information that's so important to the public, and obviously we remain committed to Salem Medical Center, and we are so very grateful for the partnership and the trust, and most importantly, how we move forward to solve many of these problems together. Thank you very much.